Yes, what we have witnessed is that since the court decision in May 2022, different restrictive measures are implemented that are making their lives impossible. So these are house demolitions, demolitions of the schools of their children, harassment at the checkpoints, violence by settlers on the roads. And all of this is creating a generalized sense of uncertainty and unsafety for the people, and their lives are becoming more and more.
What are the major challenges that MSF is facing working in the occupied Palestinian territories?
The main challenge is actually for our patients to reach us. We have not faced any severe restrictions in being able to provide the services, but before May 2022, when we were providing medical care in the village, people in the surrounding villages were able to reach us. So they knew what day we were there, and they were able to come by foot or by car to reach our medical services. With the restrictive measures, the overall mobility of the people in Masafayata has been reduced. So even just traveling to the next village, which is a couple of 100 meters away, is not possible anymore because they're being blocked at the checkpoints. And also because there's been a lot of confiscation of the cars. A lot of the villagers are left with only one car for the entire village, which means that this is only used for very serious cases. So if somebody just wants to use the car to go to the next village, this is not possible, this is not available. And in addition to that, also there's been a lot of harassments and violence on the road, both by soldiers and by settlers. And because of this, it's also restricting people's movements because they are so scared of the risk of violence and the risk of settlers. So they're just restricting themselves to their homes and to their village.
بدك ترجم لك اياهم هيدول. هي عم تقول اكثر صعوبه بنواجهها بالعمل بالاراضي الفلسطينيه المحتله وخصوصا بمفصل فرياطه هي صعوبه وصول المرضى الى خدماتنا الطبيه. نحن بنستعمل عيادات نقاله وبنحاول ننتشر بعده مناطق، انما الزياده بالقيود على الحركه منذ قرار المحكمه الاسرائيليه العليا بالاخلاء عم بيؤدي انه المرضى لا يستطيعون الوصول الينا في ضياع كبيره عم يكون فيها مصادره للمركبات، فعم تبقى الضيعه كامله على سياره واحده، فبحاله طوارئ اذا حدث تحتاج هالسياره كمان مش مؤكد انه رح يقدر يوصل لنا. فاغلب الصعوبات هي متعلقه بما يعانيه مرضانا مش ما تعانيه المنظمه، لانه نحن قادرين نشتغل.
سؤال اخير، لماذا اخترتوا سكان مسافر ياطا؟
We're focusing on Masafer Yatta, where there is other communities like the Nakab community are being subject to forcible displacement.
We have a long history working in Masafayata, over 20 years. So during the COVID-19 pandemic, the medical services that previously were provided there, they were reduced because of lack of funding. And at that moment, we were already providing mental health support to the people. So we became aware of the lack of access to medical care. This is why we started providing medical care in this area. The reason that we focus on Masafayata in our advocacy report is because we go as medical humanitarian organization, we focus on what we are directly witnessing that are the impacts of these restrictive measures on people's physical and mental health. And because we are providing these services in Masafayata through our patients, through our medical data and the testimonies that they share with us, we have a lot more to say about how they are impacted by these restrictive and coercive measures than somewhere else in the West Bank where we're not providing these services.
هي قالت نحن أول شيء متواجدين عنا تاريخ طويل مع منطقة مسافر ياطا، بنقدم خدمات نفسية صحة نفسية من أكثر من 20 سنة. خلال فترة معينة جائحة كوفيد تم خفض التمويل لكامل الضفة الغربية ومسافر ياطا بطل فيها ولا منظمة فاعلة بمجال الصحة. فنحن بما أننا كنا موجودين بنقدم خدمات صحة نفسية انتقلنا إلى تقديم الخدمات الطبية، والهدف الأساسي إنه تواجدنا على مقربة من هذه الفئات خلى يكون عندنا بيانات طبية وشهادات من الأشخاص اللي بنعرفهم كافية لنقدم فيها تقرير، وهذا الشيء بنقدر نعمله مطرح ما نحن بنقدر نشهد على الحدث. بمسافر ياطا نحن شاهدين على الحدث بينما لا نعمل بمناطق أخرى، فبيصير في اختلاف بكمية المعلومات المفيدة اللي ممكن نشاركها مع العالم.
Thank you very much. Thank you.
شكرا كثير.
Thank you very much. شكرا يعطيكم
عفوا.